out at Auchenflower, we're about probably 300 metres off the Brisbane River. And back in 2011, when we obviously had a lot of floods in Brisbane, the building went very much under. You can still see the high tide mark. One of the perks of being close to the river, with a couple of 100 metres, you can sort of walk down onto the paved cycle path, shared path, and there's 10k run done, and you can come back here into the air-conditioned gym. After or between consults, I'll sort of bring some gear in as well. Sort of move these benches out of the way. You've got a 10 to 12 metre area that you can do some really sort of functional, specific movement-based activities, as well as obviously you can load up underneath the bar. With a lot of running, I generally trying to look after my knees. I've got an 18-month-old daughter that I'm picking up a lot. Puts a little bit of pressure on the lower back, so I'm just trying to keep myself in good enough condition that I can keep up with her requirements more than anything. So active dad program, and returning back to some running. It's just to try and get your times back down again at some level of fitness. 4 or 5 Gold Coast marathons. I've done a few Brisbane marathons as well. Half a dozen. I think there's 4 down the Gold Coast and 3 in Brisbane. So 7, probably 6 or 7 full marathons. One of the big side effects you get from cancer treatment during, I suppose, that really acute active phase is that it makes people feel ordinary, really ill. So one of the things you do, obviously, when you're feeling ill is you don't do much, and that sort of leads a bit of a cycle of fatigue and deconditioning. There's a lot of results and a lot of research and evidence now that obviously is trying to stay as active as you healthily can. Enables you to stay stronger, healthier, enables you to, I suppose, cope and endure quite intensive and quite sort of harsh treatment protocols. And it's about sort of keeping the body in as best condition possible so you can get as much treatment possible. Yep, I've had a couple of guys that have come in with their chemo bags, come in with a backpack and PICC lines and everything all attached, but also as well, if they've finished active treatment and they keep staying active, you're also looking at extended periods of survivorship. The first questions I generally ask is, how are you feeling today? If they're quite high or if they're quite low, because then it's about educating them. When you're feeling like this is obviously the amount of exercise you can tolerate. Next client I get to see actually is coming in, returning to work, had esophageal cancer and surgery, radiation and the chemo was done through October, November, leading into a November surgery. He sort of spent his time in the lead up to surgery, coming in here 2 or 3 times a week, so he's up to sort of 2 to 3 hours a week in here, getting as strong and as physically cardiovascular fit as he could. Now he's been back at work on reduced capacity now since about March, April. He probably would have returned back to work, so that was probably three months after he'd been in hospital, back at work. For him to go from the nature of his surgery over sort of the end of November through December, to getting back to being in the office in March, was a great outcome for him.